we're very happy in our conference to have Professor Victor Costache from Bucharest, Romania, who is specializing in thoracoscopic and minimally invasive in general treatment of the heart valves. I think it's a good opportunity, an honor to have Professor Costache here, because we do believe that today conferences are not only exchanging scientific approaches and knowledge, but also getting to know each other, exchanging ideas, and doing things that help basically the patient. The Greek patient, the Romanian patient, doesn't matter as far as we do things to promote the cooperation, the values, and the experience in cardiology and cardiac surgery. So it's very nice to have you here, and we had a lot of discussions inside, scientific discussions, but I think the interesting thing also is just getting to know each other closely and exchanging ideas, exchanging visits, visiting Romania. I was very happy to see that you are very very well Paros, and you come every year and you have fun there. So it's nice because life is exchanging ideas, exchanging visits, and basically it's a friendship that helps the patient. So very nice that we have you here, and you'll tell us a couple of words how you can see the future of the cardiology and cardiac surgery patient. How you can see what it's evolving and what's getting less.
First of all, thank you so much for your invitation. It's a privilege to be here in Athens, beautiful capital of Greece and birthplace of European culture. Indeed, we're living in, how Confucius will say, we're living interesting times. Interesting times for cardiovascular patients, and I think we are in a period where cardiac surgeons and interventional cardiologists to work together with clinical cardiologists in the interest of patients. And right now, I think after very well that our specialty is the youngest surgical specialties. If neurosurgery, orthopedics, general surgeons were born thousands of years ago, we remember Egyptians were performing trepanations and the basic neurosurgical operations. Cardiac surgery started only 70 years ago, and we have come a long way. And right now, I think cardiac surgery has become very gentle. We can offer patients, for example, valvular patients can be treated without the classic full sternotomy, open heart surgery method. And I think surgeons should be trained in both endoscopic and transcatheter techniques, because surgeons see patients and they don't have a bias of recruitment, and they can present them and show them the best method. We speak in medicine in the 21st century and in 2025, in the majority of specializations, we speak about personalized patient care. And this is where modern cardiac surgeons should be, offering a personalized treatment for their cardiovascular patient. And the industry has brought us a lot of tools. There are a lot of tools coming in the future. Right now, cardiac surgery has gone endoscopic and transcatheter, but robotic is coming back again. Robotic came out of the picture 20 years ago, and the endoscopic techniques became stronger. Right now, endoscopic surgeons probably in the years to come will move back to robotics, but everything has to be done and blended together with the transcatheter technique.
Especially nowadays with the artificial intelligence, the robotics are going to blend together, and the robot is going to obey to the artificial intelligence commands, and of course we can see that the future is ours.
Excellent remark about the artificial intelligence. I see a lot of I see a lot of fear, and I see a lot of papers predicting the end of medicine due to artificial intelligence. I think artificial intelligence will be a valuable tool. Probably you know I'm also a vascular surgeon, and I am doing a lot of EVAR, TVARs, fenestrated for thoracoabdominal aneurysm cases. And in this in this line of work, which is also part of cardiovascular team, in this line of work we have a procedure called fusion. So 10 years ago, when we started to do fusion, it took us more than an hour with specialized technicians coming from Philips or Siemens in order to be able to align CT image with angiographic image in order to put these complicated graphs together. Right now, artificial intelligence has stepped up, and we can do fusion in a couple of minutes. And so this will also help robotics and AI integration of echo images on our hybrid screens.
Thank you very much. Looks like the future is getting very closer and closer every day, and we're going to be here every year to exchange ideas and see each other. Thank you very much.
Thank you very much, Professor. A pleasure being here. And
nice meeting you, and looking forward to a fruitful future.